It's Ashley Internet, and today we are going to be telling you all about the different types of oxygen therapy and the pros and cons of each of them. And then after, we will also discuss and demonstrate how to place a nasal cannula for long-term oxygen supplementation. If you have any questions, please hold till the end.
Alright, so while we're getting our supplies together, first things first is you want to place a couple of drops of proparacaine in the nostrils. If you're doing bilateral, you'll of course do it in both nostrils, otherwise pick a side. And so I'm going to do that real quick. Alrighty. And we'll let that sit for a couple of minutes and let it kick in while we make sure we have all of our supplies ready to go so we can get this done as quick as possible for the patient.
Alright guys, so we have our proparacaine sitting and we are good to go. We have already pre-measured and marked it. We do have 2 lines, but the first line was too short, so we're going with the second line. We have everything ready to go, and she's going to start advancing it into the left nasal passage. And I'm going to hold it over here for her just for extra hands. She's just getting her suture together. And we're off. So what you want to do is just take a nice size area so that it doesn't come out. And she's just basically going to start doing her finger trap, which I will walk you guys through. So what you want to do is make a knot, and then you do 1 knot per day for how many days you want to keep it in. So we'll do three ties. So we're good there. Now she's going to start finger trapping it. So what you do is you take both sides of your suture and cross them behind, come back forward and make 1 knot. And you continue doing that until you know your cannula is not going anywhere. So she's got 1 done. We're going to continue. Can be a little difficult with gloves. So we got 2 knots. We'll make 1 more. So cross it behind, come back forward, and do 1 more knot.
My goodness gracious.
And on the last knot, you finish it out with however many knots you do. So we'll do 3 knots on this one. You can do a few ways to finish it off. You can just finish it with your 3 knots like we're gonna do. You can decide to suture through the skin again, but I wouldn't want to be poked more than what I need. So we'll just go with that. Once she has her 3 knots, we will cut the extra off, and we know that our cannula is not going anywhere. So we have our first part of our finger trap done. This is not going to go anywhere. If it starts backing out from here, you can just gently kind of push it back in. And then we are going to end it with 1 more suture on the top of the head, just so that this isn't flying around. So she's just going to put 1 more right here. Some people decide to place tape and staple it. Some people decide to suture it. It's kind of all dependent on how the patient's responding and how critical they are and how fast you need to get that oxygen going. And you just do a couple knots on the top, and then you should be good to go.
And 1 more for good luck.
Alright,
And that is how you place a nasal cannula. And this is what your finished product should look like.
Alright, so So there are many conditions where oxygen may need to be supplemented for a patient. For example, dyspnea, shock, sepsis, SIRS, head trauma, airway obstruction, lung disease, pleural space disease, pneumothorax, aspirate pneumonia, pulmonary contusion, and sometimes drugs can be a cause. Up here we have different types of oxygen therapy methods, and we will discuss the pros and cons of each. For our flow by oxygen, a couple of pros. It's very easy to use and you have limited equipment, so there's not a lot of hassle. But on the downside, it can only be used for a short time, and it also utilizes more staff because you need someone to be holding the tube in place and keeping it close to the patient. And this is often better tolerated by the patient than a mask, and is a useful technique when patients are being examined or stabilized. This technique wastes a large amount of oxygen and would not really be practical or economical for long-term use. Our next method will be the oxygen mask. Again, it's really great because it's limited equipment and the rest of your patient is accessible for an exam or evaluation or anything like that. But it's ineffective if a patient is moving away and is fighting the mask. It can be really stressful, and it can also cause rebreathing of CO2, which could cause more of an issue to what the patient is already there for. And masks will be poorly tolerated by some patients, and another method of oxygen delivery should be employed if the patient starts to struggle or become stressed, as this will increase metabolic oxygen demand. Then last we have an oxygen cage. You hear a lot of things about this. It allows the patient to be stable with low stress. You just put them in there and you can control the humidity and temperature that's in there, and you can also attain a very high oxygen concentration. But on the downside, it's very expensive equipment and you have limited access to the patient, and also if something goes wrong with it, a malfunction, your temp and humidity can increase, causing problems. The major disadvantage is that auscultation and assessment of pulses is not possible without opening the door, and sounds of stridor or stridor may not be heard through the glass. It should be noted that opening the cage door drops the FiO2 to that room air rapidly. Some commercial cages have specialized ports to put your arm through to minimize the loss of oxygen from the cage. And that is what we have for oxygen therapy methods. So with our nasal cannulas, we wanted to talk about why these are so beneficial in a more difficult patient who might need prolonged oxygen. With the nasal cannula, you can get up to 80% of oxygen concentration when you're using bilateral catheters. And when we use a nasal cannula, we use humidified oxygen, which is really great because it prevents the drying and dehydration of the nasal mucosa, which could then lead to desiccation of the respiratory epithelium. Nasal cannula is really great for the large breed dogs that are too big to fit in an oxygen cage or would not fit in there comfortably. Also, this keeps our patients accessible for examinations and procedures and just makes everything a little bit easier. Down there in the purple bullets are our cons of a nasal cannula. Many patients do not tolerate this very well. I mean, you have something constantly rubbing in the nose and very irritating, which could cause them to want to bother at the tube. It's also difficult and really not ideal for any brachycephalic breeds. If you do have a brachycephalic animal come in that needs oxygen, evaluate your other methods first before resorting to a nasal cannula. And that is why we love this method.
One of the major diseases that we wanted to touch on, since it's such a big problem in our area right now, is the canine influenza. And it also works out because when these cases go too long without help, they need oxygen therapy and they need help. Usually when these animals present, they present with clinical signs of respiratory problems. So they present with signs of pneumonia, they have a high fever, and they have increased respiratory rate and an increased respiratory effort. And this disease is transmitted through the droplets or aerosis containing respiratory secretions from coughing. And when they come in, they're coughing so hard, they have lack of oxygen. Sometimes these animals, when it goes on for so long, they are obtunded. And so we wanted to just touch quickly that This is a very major problem, and a nasal cannula and any type of oxygen therapy could be very beneficial for these animals.
The party was poppin', and everybody having a ball. Until the fellas started calling, and the girls responded to the call. The boy showed us who let the dogs out. Who let the dogs out? Who let the dogs out? Who let the dogs out? I see you see all about those shitty onions get out. Get that coffee, get that juicy and biscuit mongrel. Gonna tell myself I might not get angry. Too many cows calling them canine. But they tell me, hey man, it's not up the coffee. Put a woman in front and a man behind. I hope who wants your house. Who let the dogs out? Who